think bringing it back to the theory of self-healing, it's that it's a continuous, ongoing process. It's not a trophy you get once and you did it and you've mastered self-healing. It's something you learn and you relearn and you reapply and you relearn. Hello, my name is Dr. Kerry McBroome. I'm a licensed psychologist. So the letters after my name, Sci-D, refer to Doctor of Psychology. So in my case, clinical psychology. I love that face-to-face therapy work. Or in many cases, Zoom-to-Zoom therapy work. So in terms of like education and background and all of that, I'm coming to you from Brooklyn, New York. This is the city I got my undergraduate degree in. My college degree was from here, my bachelor's. And then I did my master's and my doctorate at a consortium program. So that was out in California. It was run by the PGSP Stanford Consortium, if you're familiar with that. It's through Stanford University School of Medicine, and then a local school, Palo Alto University, that just does practical psychology. And then specialties, I really was not sure when I first entered grad school which populations I wanted to work with and what type of theories I wanted to work with. I was just reading where there are like 800 different kinds of therapy. And so I went in kind of this open book, like what am I going to discover? And then I got my first taste of the kind of therapy I do today through a training group at Stanford University. And I hadn't even heard of it before. I went to one of their trainings and it was just like, this is the one that sings. This is the one I want to try in my own life. Let's go. And that type of therapy is called DBT, Dialectical Behavior Therapy. I'm so happy to get to talk to you about it today because I just love it so much. It involves, as you would imagine, given the name DBT, the BT, the behavioral therapy, it involves a lot of strategies. It involves a lot of like concrete, data-driven, evidence-based treatments. So each of the elements of DBT has experimentation behind it and evidence behind it that says this really does work for this particular population or that particular population. And so that's kind of like my theoretical specialty. And then my, I suppose, life specialty, I work predominantly with LGBTQ plus populations. As a queer therapist myself, it was really hard trying to find other queer therapists who get it. And so that's what I got into in terms of my own work, my own private practice. I'm thinking in terms of the people that I work with. So often it's not just that one concrete. I'm thinking like the rates with anxiety that's comorbid with depression, where you're seeing most of these symptom clusters all at once. And then not so much couples therapy, but more relationships therapy. So again, working with this population, we often see polyamorous groups, thruples, triads, etc. So I would contextualize it more as relationship therapy. So I really love what you were saying about not wanting to be in therapy forever, because I truly think as a therapist, my job is to put myself out of business. My job is to not be a permanent force in the lives of the people I work with. I'm trying to give them tools so that they can use them. So in terms of the definition, I kind of think of self-healing like a subway map to a city you've never been to. I think of it as sort of like, okay, if I'm in a new city, I'm looking at a subway map for the first time, it's confusing. There doesn't seem to be a lot of clear, straight pathways from where I'm at to where I want to be. There's so many different options. Things are looping around, can be confusing, it can be chaotic. And so self-healing is when you, not one right correct path or one right correct subway line, but lots of different paths to choose to get to growth, to get to the goals that you came into therapy with originally. And then my job as a therapist is to help kind of navigate that subway system. So you can think of it like DBT being one city guidebook that you can use that can say, hey, here's one option that other people have tried, or here's one route that we would recommend for getting to where you want to go. With the self-healing strategies you get from DBT, a couple of them are relationship oriented. In fact, there's one module that's called interpersonal effectiveness, and it's all about being in community and making those connections and strengthening those connections, or cutting off those connections when that needs to happen. At the same time, though, the majority of skills in DBT are designed to be tools you can use without needing anyone else's help or without relying on other people or other environmental things around you, but to be able to kind of stand on your own feet and say, I got this. I know how to use this. So the first skill that I think of when I'm thinking of self-healing comes from the crisis survival skills section. So this is a tool that you would reach for if you're like mid panic attack with anxiety, or if an impulse that you feel like it's getting out of control and you have to do this thing, even if you don't want to do this thing. So that could look like substance use, or that could look like self-harm. That could look so many different ways. The question is, what do you actually do in that moment when you want to give into that impulse and you know long term it's not actually what you want? So the skill that we use in crisis survival, or one of the skills, comes from the acronym TIP. I use it kind of as my own ruler with other therapists who say they do DBT. I say, hold on, do you teach the TIP skills or not? Because that to me is one of like the foundational elements, one of the skills I get the most use out of. And so anyway, TIP, it's one of the crisis survival skills. The TIPP, the second P, that's the skill I want to talk about. It's called paired muscle relaxation. So ideally on your self-healing journey, you get to a point where you have this kind of in the back of your mind as a tool you can whip out when you need it, when you're in that crisis scenario. So it's called paired muscle relaxation. The idea being you're pairing the tensing and releasing of different muscle groups with your breathing. So it takes the classic mindfulness breath work. We're inhaling, we're exhaling, fairly standard stuff when it comes to anxiety regulation or emotion regulation techniques. But then it's paired with a somatic experience. It's paired with something you're physically doing in your body. So if I were going to demonstrate right now, okay, for me, I hold a lot of tension in my shoulders. So when I have like an important deadline coming up, or there's a legal document that I need to file and I'm overwhelmed, maybe a hard romantic relationship question, whatever it is, I come back to this tool and think, okay, well, I know it's coming up as tension in my shoulders. So what I do is, okay, tense that muscle as hard as I possibly can. So I kind of like pull my shoulders up to my ears, hold it as tight as I can while I inhale, and then release on an exhale. We do this 2 more times. If you would like to try the skill with me, you are invited. Going at your own pace on an inhale. We pull up the shoulders, tense, 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 tight as we possibly can. Hold it so tight, so tense. And then release it on an exhale. It is important with repetition, so just to do it a 3rd time. We inhale, lift up the shoulders, tense and tight, tense and tight. I'm also like tensing up my facial muscles. That's an option if you would like to modify. And then we exhale, we release. Even right now, in the midst of this interview, I feel a little bit of the tension in my shoulders going through. This is one of those skills I really love. And it's okay. So the idea with this one is you can kind of DIY it. You choose for your body what works. If there are parts of this that are not going to work for given body parts, by all means. Popular spaces would include the shoulders. Lots of people do the hands. It's a good one if you're in a part of the world where you're driving a lot. It's a good one when you're driving, because I'm thinking traffic or road tensions can definitely get to us all. And so you can like grip the wheel as hard as you can, release, grip the wheel, release, grip the wheel, release. And again, it's called paired muscle relaxation. So you want to be sure you're pairing it with breathing as well. And then what this does kind of on a cellular level is to acknowledge the stress and tension that your body is feeling in those moments of anxiety, and then go through the process of physically changing something so that your body has a way to release that tension. It's just one of the crisis survival skills. This video would be 7 hours long, 12 hours long if we went into all of them. But I just want to throw that one out as an example of like what this one strategy actually feels like to use. And so then to connect this back to your second part of the question, which was about like my own personal self-healing, I think I tell every client I work with at the beginning of therapy, I will never teach you a skill that I don't use in my personal life. It's not like every skill works in every scenario. It's not like a perfect cure scenario. But each of the skills I use with clients, I have gotten use out of myself in my own life. And I feel good about that. I feel a little smug when I say that at an intake session. Oh, yes, look, I'm using these skills in my real life. And it works for a while until sometimes I really need to refresh. And I got one of those moments recently. It was with grief. So we lost a close family member last year around this time of year. So kind of tricky bringing it up and talking about it. But I think it's a good example of self-healing because it gets back to that idea of like, you chose this as your career. You want to be using these skills in your personal life. And you think you've got them because you teach them. And then life comes in the way and says, hold on, there's more to learn. So I think bringing it back to the theory of self-healing, it's that it's a continuous ongoing process. It's not a trophy you get once and you did it and you've mastered self-healing. It's something you learn and you relearn and you reapply and you relearn as life throws more curveballs at you. So as I'm going through grief with this family member's passing, what came up for me in my body was a lot of anger. I was so upset with this person for the way that they were not in my life anymore, which my logic brain tells me doesn't make any sense, that they didn't do anything on purpose. And the emotional side of my brain, what we in DBT call your emotion mind, is telling a very different story, which says, there's this anger, this intense rage, this despair, all of these really intense feelings, these intense emotions. And they very much got the better of me, and I'm overwhelmed with them, and I have no idea how to get rid of them. And I don't even want to get rid of them because I don't even realize this is a problem until it becomes clear that, hold on, I'm grappling with something, I got to slow down. And so in that particular moment, self-healing looked like coming back to the basics, coming back to the non-judgmental stance. So the core of DBT, the group of skills on which all the other skills rely, is mindfulness. So the practitioner of DBT, the woman who founded it, her name is Marsha Linehan. She is herself a Zen master. And so she uses Zen mindfulness kind of as like the foundation that all the other skills are built on. And this particular skill, non-judgmentalness, it's one of the 6 skills that you teach. It sounds like exactly what it is, non-judgmentalness. It's letting go of judgments, particularly like evaluative judgments. So by that, I mean, this thing is good and that thing is bad, or this emotion is acceptable, but that emotion is unacceptable. That's not non-judgmentalness. That's more black and white thinking. With non-judgmentalness, we're trying to let go of those evaluations. So we're not saying it's wrong to be angry at this person for dying. We're not saying it's okay to feel sadness because sadness is a good thing to feel. We're coming back to non-judgmentalness. We're letting all of that go to accept the reality, which is I did feel that way. And the reality that the full range of human emotions might come out during grief. Something I tell my clients often, but wasn't remembering to give myself time for in that moment as I got lost in that grief. So self-healing looked like holding on to that tenet of non-judgmentalness, allowing myself to feel the feelings that were coming up without evaluating them as good and bad, without trying to force them down, and without really clinging to them. Well, I mentioned being part of the LGBTQ plus community, and that for me has really shifted my perspective. I think I kind of bring a queer lens to the work that I do. I'm thinking about those clients I've seen who I've been the first person they've come out to, what a privilege that is, what a responsibility that is. Those have been some of my absolute favorite people to work with in my life. And so I think, okay, I want to work specifically with this population. That is what I do every day. Even when I'm not working particularly on, say, like a question of sexual orientation or a question about gender identity, that's not always what you want to work on. Maybe there's other parts of your life that rise to prominence. Maybe there's other things we want to focus on. But even in those other scenarios where the queer identity isn't the number one thing we're talking about, I still bring a queer perspective to those other things we're doing. So to tell you what I mean particularly around this, one of the core tenets of DBT, the D that in the title stands for dialectical, which sometimes frightens people off, but stay with me. It's a term from philosophy. It means holding, well, many different things, but I would say one of the core meanings would be holding multiple things true at the same time. And that to me hangs very nicely with the queer perspective because we're used to looking outside of binaries. A black and white perspective does not always work for queer people. We've had to kind of find an existence and find a way of queering that lens. And so the perspective that I bring to the work is very much informed by this idea of multiple perspectives existing, multiple things being true at once. So I think a recent example of this would have been I work because I do work with anxiety. I work with a lot of people who have that harsh inner critic, that inner voice that says and does things about like you're not good enough or you'll never be good enough. Those core beliefs of inherent flawed nature or inherent shame often comes up. And so this queer perspective, this dialectical perspective says it is true that you are working as hard as you possibly can in therapy or in your relationships or in your job or whatever other elements. It acknowledges how hard you're working. And at the same time, it says you need to work harder. I need you to be doing more. I need you to be trying harder on a given therapy goal or whatever it is you're coming in with. So it kind of, again, getting back to non-judgmental stance, it's very freeing because you don't have to say, no, I've tried so hard, you don't understand. And you don't have to say, I'm not trying hard at all and I'm a worthless human. Hold on to both elements, both parts of that are true. Yes, I am putting in the effort and I'm striving for self-healing and I'm trying to quit smoking or whatever the element is. And there's more that I could be doing. I want to recommit to this work. I want to try harder. So many other beautiful therapeutic traditions out there. So much of what I see in DBT, but across many different types of therapy, is that one of the major factors contributing to whether you make any progress in therapy is the quality of the relationship you build with the therapist, right? It's about how you click with this person, how it feels when you're with them, what you fundamentally can trust them with or what you can't. And so across all of the clients that I work with, that building a real genuine relationship has got to be a piece of it, or I'm just wasting their time and wasting my time. I think the first one would have to be vulnerability. I think in the culture that I grew up in, what we were taught as kids was very much like strength is strength and weakness is weakness, and your emotions and your vulnerability and your human messiness goes in the weakness category, and we try to minimize that. And I would say that first element or concept of self-healing would be letting those judgments go and honoring your vulnerability as a strength. I do not know of a person who is able to get to self-healing without a certain degree of vulnerability, without a certain degree of awareness of their own limitations and fear that they're not going to be able to grow and embarrassment over times that they maybe tried and it didn't work, or those parts of themselves that are hardest to love. Again, coming at it from a queer perspective, lots of internalized shame. That involves a lot of vulnerability to stand openly as your full self and to reach out for help if that's what you need. So I think that first main concept has got to be vulnerability. If we don't have that, I think the way forward is going to be a lot more difficult. Maybe not impossible, but pretty close. The second core concept, I would probably bring it back to dialectics, like I was talking about letting go of black and white thinking. I think if we've got the vulnerability to admit that there is something that we want to work on, and the vulnerability to be open with the person who's helping us or open with ourselves about what we need and what we actually want our lives to look like, we've got to also be open about what parts of us don't want to do that healing. Maybe what parts of us are very comfortable staying the way we are right now. So I think the dialectical perspective, where we hold on to the parts of us that want to heal and the parts of us that want to stay, are both valid. And then let's see, the third last one, it's another DBT concept. It's called wise mind. If you're familiar with wise mind, it's this idea of facts and data from my logic side of my mind. Think your calculator brain. This is a part of your brain that's engaged when you're doing a math test. This is the part of your brain that ignores empathy and other people and their needs and only focuses on evidence. Versus the other state of mind, your emotion mind, where you're more aware of the feelings of the people around you, your own emotional needs, the full range of your feelings. That has useful data too, even though it can sometimes be overwhelming, because they both can be. So wise mind is what you call it when you're holding on to both of these states of mind. They're synthesized. So I take all the logic and the information my emotion brain is giving me, and I take all the data from the logic side of my brain, and I hold on to them both. Kind of another dialectic, right? I've got both of these parts of myself. And when I hold on to them both and I make decisions from that wise-minded part of myself, then I'm able to make great leaps and bounds in self-healing. I'm going to, in true DBT fashion, go last but not least into another skill, which is called opposite action. This is what I recommend for my people who are totally overwhelmed by the number of different therapists and the number of different options and the number of different self-help books. Where do you begin? What's the next right step? How do you even start in finding someone you actually click with and do actually want to work with? All of that uncertainty can lead to avoidance, and I don't want to, and you can't make me, and I'm not going to call a therapist. That's too intimidating. So the skill that we use in that moment is called opposite action. It's actually borrowed from CBT. If you're familiar with what they call behavioral activation, pretty much the same skill. DBT just gives you the step-by-step for it. So the idea with that one is, if you have an emotion that's overwhelming you or that's blocking you from the life you want to live. So in that case, if you were overwhelmed by therapy choices or you didn't know how to get started, you figure out what the emotion you're feeling is. In that case, it might be fear, it might be embarrassment. And figure out what the intensity of that emotion is. How much do I want to avoid getting into therapy? How much do I want to avoid self-healing? And then you figure out what the urge that emotion is giving you is. So maybe the urge is to call a potential new therapist, but don't call them back once they reach out to you. Or it's to go back to doom scrolling on Instagram so you don't have to figure out how to move forward in therapy. Well, those would both be avoidance examples. Okay, so you figured out what the urge is. Then the next step is, like the title makes it sound, opposite action. You do the 100% opposite thing to that urge. So if the urge is to avoid, you pull your whole full self into doing that feared thing. The opposite of avoidance is approach. So you call 4 different therapists and you leave a voicemail with the information that you need them to know, and you answer the phone when they get back to you on the first ring or over email, whatever works for you. And you do this again, fully, radically, completely with your whole self, your back, your spine, your body, you're doing it. I would say, if you're hesitant about reaching out to therapy, this could be the skill for you. Opposite action. Feel that hesitance fully and act anyway. I use it again in my own life. If it's a DBT skill, I'm probably using it. So that's what I can give my own stamp of approval on too. And then if you're drawn to want to working with me, my therapy practice that I started is called Full Focus Therapy. You can reach out to me via my first name, Kerry, Kerry, at fullfocustherapy.com.